IUI, or intrauterine insemination, is a process where partner or husband sperm or donor sperm is used to go inside the uterus for fertility. Whether it's medicated or not, it's a little bit more likely to be successful if it's medicated, but essentially the big difference would be that in a patient who has a regular cycle, we would figure out when that woman was her most fertile, and then we would trigger her, give her a shot to induce ovulation, and then we would time the insemination based on that. In a woman who's on medication, she would start on medication usually starting on day 3 to 5. It depends kind of on how your doctor wants to do it. But day number 1 is the first full day of menstrual flow. And the medication usually is given for 5 days. There's 2 different types that we use. There's either a medicine called clomiphene citrate or Clomid. The other medicine is called letrozole or Femara. The purpose of both of those medicines would be to potentially make a woman produce more than 1 egg. And sometimes, in the case of Femara, sometimes it may help the lining just a little bit or improve the endometrium. In the case of Clomid, not so much. But essentially the purpose of that medication is to try and give you a little bit better chance of getting pregnant. And so if a woman just does insemination, she has about a 5% chance per month if she is truly an infertile patient. If she does a medicated cycle, it's about a 10% chance per month of success. So patients are really surprised by the inefficiency of reproduction. So, even the most fertile woman at the peak of her fertility, best case scenario, has about a 20 to 25% chance of pregnancy. If a couple has tried for more than a year and hadn't been able to conceive, unfortunately, they only have about a 1 to 2% chance per month. So if we do intrauterine insemination, that bumps it to about 5%. If we do oral medicine, that bumps it to about 10%. And so generally in medicine, and this is data from the 80s, generally we recommend with a fertility treatment, because the chances are not that great in a given month, we recommend usually doing it for 3 and maybe 4 cycles at the most. At that point, it doesn't necessarily hurt you to continue to do that, but you're just kind of spinning your wheels, and it's probably not likely to be all that effective in month 5, 6, 7, etc. So for men, if there's a male factor issue, meaning the sperm count is low, it's kind of shades of gray. Most of the things that we do in medicine are not real black and white, but generally speaking, in order for a male patient to be a candidate for intrauterine insemination, his count would either have to be normal, so we actually sometimes will take normal sperm counts, or men with normal sperm counts, and do IUI. But if a count is below a certain number, about 10 or 12 million moving sperm is sort of our cutoff. And if it turns out the count is a lot lower than that, those are candidates more for in vitro fertilization. But if it's between that 10 or 12 million all the way up to normal, which is about 15 to 20 million, those are men that certainly would be candidates to do intrauterine insemination. So the risk associated with a medicated cycle, primarily from a fertility standpoint, is the risk of multiples. So there's about a 5 to 10% chance of twins, less than 1% chance of anything greater than that. And it's interesting, a lot of my couples will say, oh, that'd be great if we have twins. But in reality, from a medical perspective, a twin pregnancy really is a riskier pregnancy and more likely to have complications and problems. So we really don't try and get people pregnant with twins, but whether we try or not, there's that baseline 5 to 10% chance of twins. The other risk with a medicated cycle is the fact that when a woman ovulates, the egg is produced in a cyst, and that's a normal thing. The cyst breaks open, the egg comes out. But what can happen sometimes in medicated cycles, maybe because you're producing more eggs, or maybe because the medicine has a longer half-life, sometimes those cysts that are normal can hang out in your system a lot longer. Sometimes they can even get big, and sometimes they can even cause pain. And so generally, if you have a cyst that remains after the egg is ovulated for an extended period of time, usually we have patients wait a month or 2 until that cyst goes away before we restart the cycle again.